GMT. It's Good Morning Tobago. I'm your host, Natalie Seeley Richardson. And I know on Friday, I told you, see, Chanel, I forgot I was going to be on this morning. So I am here, we are here, and thank you for staying with us and viewing this morning. It's Monday the 14th, July 2025. And I know school has officially closed last Friday and the holiday begins. Many of you have been ushering out your children into the various vacation Bible schools, summer camps. I know many of us don't like to use the word summer camps, but that's what we're using now, right? July, August vacation, yes. And we have to keep the young ones entertained and occupied, but please ensure their safety. I know you're dropping them off to various camps. Make sure you know where your child is and the environment in which they are going to be spending time over the July-August vacation. And with that said, let me introduce my guest for this morning right away. We know her. She's been in the news quite lately for some reason. I don't know what's the special attention we're giving to her, but she's here with me this morning. Dr. Faith Brebner, our Deputy Chief Secretary and also Secretary in the Division of Health, Wellness and Social Protection. Good morning and thank you for being with us this morning.
Good morning and thanks for having me again in the news.
Yes, and I'm getting right into it. Now, recently, I know the Ministry of Health would have paid visit. We know that we have a new central government. The ministers have been visiting Tobago, trying to, I guess, understand what's happening on this side as you know, governments work together. Can you tell us about the significance of that visit and as secretary, what you hope comes out of such a visit like that?
Certainly. So it is a significant because now that you're saying it, I do not think that I've actually toured the hospital with any other minister before this one. So it is truly significant, probably more than I had thought when it was actually happening. But you know, when the government shifted, we had an understanding that we were trying to work together in a way that did not happen before. Not for want of trying, but it simply did not materialize the way it should have, but it is materialized now. So shortly after, I visited the minister at the head office in Port of Spain. I actually visited 2 or 3 of them at the same time. And at that time, I invited him to come to Tobago to see what we were doing and to determine whether there were ways that we could truly collaborate. You know, whenever you hear the budgets being read, you usually hear about the amount of money that the Tobago House of Assembly is being allocated. But you always then hear about the additional monies that are being spent in other ministries in Trinidad that should be spent in Tobago. And for the last 3.5, almost 4 years, we were wondering where that money is spent because we didn't see it here. Now, it seems like there may be opportunities for that kind of partnership to truly happen. And that is why the minister was here. So we visited several components within the Scarborough General Hospital. One of them is the cath lab that has been in essence defunct for quite some time. I mean, he has spoken publicly about ensuring that cath labs are available in Trinidad and Tobago. So when he came, he specifically wanted to see the status of our lab to determine whether it could actually be one of the priority projects for the Ministry of Health to ensure that at least one functioning cath lab is on the island. And it is that kind of collaboration. We speak when we need to about projects. He calls me very frequently if there is something happening and he needs to get a full update. I call him. So the relationship is one where we are cordial. The relationship is one where there is mutual respect. And I think that is the critical part. So I'm excited about the visit and I'm excited about the things that can come out of the visit. First of all, being the cath lab whenever that happens, but we are also talking about other projects that we could work on as well to ensure that Trinidad, the healthcare in Trinidad and Tobago is fine, and specifically that the healthcare in Tobago is significantly improved.
What was your staff's response to that visit? Because he would have brought his team, and of course you have your team on this end.
So my staff, they actually were really welcoming. I almost had to tell them, "Oh, you're doing too much," because it was exciting to finally have a government that seems to honestly respect you
Right.
and to honestly respect what the Tobago House of Assembly is and how the Tobago House of Assembly is supposed to function. So it was critical in that regard. You know, I could see the excitement and the possibilities being thought of, and, you know, ideas being, you know, popping up, because we can now think about how we can truly work together. So they were excited, and it means that the projects, some of the projects, for example, that we have put into the budget, for example, so we know that, you know, the recurrent spend that we request for the division is about 800 million. We request another couple millions for DP. We are having those conversations as to why we are asking for this money,
Right.
as to why we need all of it, most of it, if not all of it.
Right.
And those are conversations that I've never had before. So I am hopeful.
Right, that's excellent. And let's just quickly talk about Roxborough, because we know I have heard many persons talk about, oh, I don't mind going to Roxborough Hospital. You know, I don't know what's going on at Scarborough, but you hear, especially senior citizens I come across with, and they talk about how they are treated and they get through. Give us a little update about Roxborough.
Well, you know, I'm glad you spoke about the senior citizen thing, because Roxborough actually has an accreditation, a special accreditation for I'm not using the correct term, but in
Yes.
essence, is senior citizen friendly.
Right.
The same, almost the same way the Scarborough General Hospital has a baby friendly
Yes.
accreditation, Roxborough has a senior citizen. So maybe that is what you are seeing
Right.
playing out,
Yes.
which is wonderful. So Roxborough, we are still working through ensuring that we can do as much as we can do in Roxborough. The physical structure honestly was not purpose built for a hospital.
Right.
And because it was not purpose built for a hospital, we've had to spend quite a bit of resources getting it up to the stage where we can do hospital-like services,
Right.
which we are doing. I have to say to the team up there, they've been doing an amazing job at building out the services, but it is a work in progress.
Right.
And as we are working through everything that is happening now, we are actually thinking about what we need to do to possibly even expand the footprint of Roxborough so that we can provide even more services to the people of the East, so that they don't have to come to Scarborough for everything.
Right. And let's just talk about, you know, general customer service. We know, and when you look at Scarborough Hospital, I mean, it has to take a lot.
Yeah.
It's not like you have many options. Yes, we have the health centers, but we know some of us, we love to go A&E. I don't know what's the pull, but you have Canaan, you have Scarborough, the larger health centers who can usually deal with a particular issue. But many of us are wired to go to Scarborough General Hospital. And sometimes we put some pressure on the A&E staff there, who has to now filter and find space for us. Not just looking at customer service in general. When people are warded, when they have to be discharged, you know, when you look at the division's page, whether it's on social media, the vision, the mission, it looks so grand, and it makes you feel like, yes, but sometimes one's experience doesn't match with what's there in print. What is the division doing to ensure that, you know, your staff really understands the environment in which they work in? And sometimes they need to show some empathy.
A bit more empathy.
Yes.
Yeah. So I like to think about things from a systemic point of view. And yes, you are correct. I probably more than anyone else get the calls, get the messages, get the tags on Facebook, get the videos sent to me about the negative experiences people have been having. But what I've been saying is, and I've said it to the TRHA, we need to work out what is the systemic issue. So people respond negatively when they are not in an enabling environment.
Yes, true.
Yeah?
Yes.
So that is it. What makes the Scarborough General Hospital an enabling environment is what we have to ask ourselves. If you are going to A&E, it means that you need to have the diagnostic tools to ensure that you are not sitting there for hours and hours. You can get diagnosed quickly. We can figure out what's going on with you and send you to wherever you need to be. Are those diagnostic tools available? In many instances, they were not, and we are building on them. As a matter of fact, later this week, I will not say just yet, but but later this week, we should get a release sent out to the media to invite them to the commissioning of a nice piece of equipment that they are working on right now. So we have to look at it from that perspective. We also need to look at this, the workflow of things. And right now, I've actually tasked the TRHA. They have started working through how do we ensure that the workflow makes sense. So when the patient comes in, what is the first point of contact? Does it make sense that this is the first point of contact? And then when that happens, what happens next? And we are kind of working through treating with those things so that the overall experience for the patient is a swifter, more efficient one. And that would help with the customer service part of it, because you don't want a system where you have two sets of people who are just very upset.
Yes. And it happens.
And on the back end of it as well, what we've also been doing is trying to beef up the actual staffing complement at the facilities, because we were severely understaffed for quite a while. So we're actually now hiring the doctors, the nurses, the ENAs, the other auxiliary staff, and so forth, so that the staff themselves, when they get to work, they don't have to worry about the fact that they may be the only nurse on the ward. They're working overtime and they're just very upset. And then that is what you see that transfers to the patient. So as I said, we're looking at this from a systemic point of view to try to ensure that we have all of the pieces that fit together to provide the best quality care for people. It is taking a little bit of time, but like everything else, these things take time. It is taking resources, because you know, the machine that we're talking about is like a $10 million. I always tell TRHA, whenever I talk to them, I feel like if we're playing Monopoly, because everything is $10 million for the TRHA. But it's all part of trying to develop the system and ensuring that the system works for everybody.
And you know, you mentioned you get the calls when something negative happens, but we must admit that you have staff that goes beyond the call. I have met some of them. You know, you have some doctors, nurses, even the clerks that are there. I always talk about the phlebotomists who work in the clinic area. You all are the best. Good morning to you. You know, so that we recognize many of you who sacrifice, you work the hours, you put in, you ensure that your patient is comfortable, and we really appreciate that. But we live in a society where negativity usually gets the headlines and all the noise is made there. But we want to salute those of you who understand your role and really have made, you know, the public health sector stand on its own, and many of us are served by it. So thank you very much this morning. Now, viewers, we go for a quick break. When we return, we switch gears a bit. We talk about that press release we saw coming out of the TRHA July 8th. Many of us were concerned, worried, how did this happen? What does this mean? So when we return, we continue to talk to Dr. Bregner about that situation.